Hi again to everybody. This is, I believe, would be the second lecture for the second week of Kinesiology 376, our biomechanics class. What I'm intending to do, I think I've mentioned a few times, is I'm going to release all of the PowerPoint presentations without narration, so you can use these to follow along, and then with narration as well. And I'm going to release the entire week as a batch. So for second week, you'll have all the presentations you need for that week, third week, so on and so forth. So in this lecture, we're going to be looking at muscle properties. We're going to be talking about, what a muscle is, how it works, some of the a little bit of the physiology behind it, and then kind of the structure and function of muscles. And we'll talk a little bit about muscle groups as well and the different types of muscles. Um, there's a considerable amount of questions from this presentation as well. So once again, if I've been talking too fast or you don't understand something, please try to get a hold of me. So before we start, we'll just kind of do a little review and practice on some of the terminology and concepts we'll be using. So first, what is a multi-joint movement? From the name, it's fairly simple. Multiple movement that requires multiple joints. So what would be a good multiple name muscle groups responsible for that movement? So what would be a good multiple joint movement? Well, in the last lecture on our qualitative analysis, we started out looking at running gait. But let's just talk about walking gait. What types of joints? Are there more than one joint that's used in walking? Yes, basically almost all of them. But let's try to make that a little bit more simpler, and we'll just talk about lower body joints. So just hips, knees, ankle, and feet. Okay? So name the muscle groups responsible for that movement. Well, we looked at that at the last lecture, but we need our hip extensors and flexors, our knee extensors and flexors, and then our plantar flexors and dorsiflexors. Name the type of contraction those muscle groups are using. Here's where we have to be a little bit more detailed, because there's three types of contractions a muscle can do, and they're all very important for what type of movement is trying, or the end outcome of that movement is. So if we're trying to do forward motion of a joint, we might need an agonist doing a concentric contraction. If we're trying to make sure the trunk of the body remains upright, we may need a stabilizer or neutralizer doing isometric contractions. We also need to make sure the antagonists of a muscle group are either relaxing or doing an antagonistic or acting antagonistically by doing an eccentric contraction. And we'll talk about those in just a bit. So the biomechanics of human skeletal muscle. What are the basic behavioral properties of a musculotendinous unit? They should be able to contract to cause movement. Should they be able to receive a signal from the central nervous system? Should they be elastic? And when I say elastic is after they're stretched or contracted, after that stimulus is relieved from the muscle, should they go back to their original shape? Yes. How do skeletal muscles function to produce coordinated movement of the body? It's kind of complex, but we need muscles to be innervated, to relax, to contract at specific timing points within the actual movement itself. And then what are the most effective training exercises to increase strength of a muscle? We'll talk about that as well. So just a little bit of terminology. The neuromuscular system. This is a combination of the nervous system and the muscles. These are often referred together because muscles will not activate unless stimulated. This is a bit of pet peeve of mine when people say when people refer to muscle memory. Muscles do not have memory. They never have had memory. For a muscle to do anything, it needs a signal from the central nervous system or peripheral nervous system as well. But they don't decide to do things by themselves. They don't remember to do things. That's your nervous system. So, unless there is a signal from the nervous system, a muscle will do pretty much nothing. Then the musculotendinous unit. What is that? That is the muscle and tendon. Okay, it's in the name. So we have the muscle tendinous unit in the neuromuscular system, but muscles in general go through 3 types of contractions. We have the concentric contraction, which is kind of the classical idea of a muscle contraction in which the muscle shortens while contracting. So when you're trying to do a bicep curl or bring a cup to your mouth to drink something, the biceps are performing that flexion phase and they shorten and bring your arm up closer. They control the upward motion of your arm. The opposite of that is the eccentric contraction. This is where the muscle lengthens while it's contracting. This seems a little odd that it's contracting but lengthening at the same time. But what we're saying, what a contraction is, what the real definition of a contraction is the muscle is developing tension. Okay? Within the muscle, if you remember from, if you've already taken physiology, which I hope you have, but for a muscle to create tension, there needs to be cross bridges between the myosin and actin filaments within the actual muscle itself, within the sarcomere of the muscle. When those cross bridges are made within the sarcomere of the muscle, it creates tension. Just because it's lengthening doesn't mean it doesn't have any tension. Unless it's completely relaxed, it's still developing tension. So, for example, if you're looking at, you grab the barbell and your elbow is already flexed, but the barbell is a little bit too heavy for you and it's dragging your arm down, even though you're still trying to pick it up, but it's forcing your hand down, your muscles are still contracting, but they're being forcefully lengthened at the same time. And we see this too when just normal strength training. What you're supposed to do is as soon as you lift or move a weight, you're supposed to bring it back to its origin in a slow and controlled manner. You're using eccentric contractions to do that as well. Even if you're walking downstairs, you have to do eccentric contractions to make sure your legs and trunk are going downwards in a controlled fashion so you just don't tumble down the stairs. And then the third type is an isometric contraction. Iso means same, metric means length. So this is where the muscle stays the same length while contracting. So this is if you picked up the barbell, once again, you're trying to do arm flexion curls or bicep curls, and you picked up a dumbbell that is exactly as heavy as you can move it. So you're just holding it still. That's an isometric contraction. Your muscle's still developing tension, but nothing is really moving. Bodybuilders do this when they're posing as well, just so they can show you their muscles. So here's an example of a concentric and eccentric contraction. So here we see that the muscle is creating the appropriate amount of force, and it is going to be shortening towards its center. When it does that, it's going to bring the arm upward. This is going to be shortened. It's a shortened muscle now. So it might even pop up a bit. But that's our movement, is the upward movement, it's the desired movement maybe, and we're seeing a concentric contraction as the muscle shortens towards its center. The opposite of that is we're seeing the downward movement. The muscle is still creating tension, but it's being forcefully lengthened as well. Okay, so we see this down movement occur. The muscle is getting a little bit thinner maybe. So the muscle has 4 behavioral properties, and this is of the musculotendinous unit. The first one, the muscle has to have extensibility, or the ability to increase in length or be stretched. If it doesn't, if you're trying to do a bicep curl once again, and your triceps do not have any sort of extensibility, you can't move your arm because they won't be able to increase in length to allow you to do any flexion. Elasticity, the ability to return to normal length after a stretch. Also important, if you stretch your muscles and they get really long and they never go back to their original shape, you will never be able to use that joint properly again. So that's where we look at it. The limits of elasticity in muscle is when a muscle tear develops. Also, they need to be irritable. Not that they get angry when you ask them to do stuff, although that happens sometimes, is they have to have the ability to respond to a stimulus. That's when we talk about the motor unit of a muscle, which we'll talk about in a bit, is being stimulated by the central nervous system to recruit the muscle fibers to contract. And obviously, they have to have the ability to develop tension. So this is kind of schematic of our musculotendinous unit. And there are a couple components to the musculotendinous unit. We have the parallel elastic component, which is part of the muscle membrane. Then we have the series elastic component, which is part of the tendon. And right here we can see, if I'm reading this correctly, is kind of our sarcomere here, where we're looking at our myosin and actin filaments developing tension. That's our contractile element. So look at this a little bit differently. We have two major components of our musculotendinous unit. We have the elastic component and the contractile component. Our parallel elastic component is part of the elastic component. This might be important for your first exam, who knows? But our parallel elastic component is provided by the muscle membrane itself. And then our series elastic component is provided by our tendon or tendons. When you stretch an elastic structure, let's say a rubber band, it requires energy. When you take a rubber band and you start stretching it outward, you're placing energy within the rubber band itself. We call it strain energy, okay? Same thing if you guys have taken physics yet. I think you guys have to take physics. But if you remember, if you took a lab or they covered it all called Hooke's Law, it's basically you're trying to figure out how much energy is in a spring when you stretch it. Same sort of thing. When you stretch something, especially something that's elastic, you're placing energy into that system. As soon as you release it, though, it will shorten automatically and start releasing that strain energy. Therefore, you get movement without any cost, which is not technically true because there's no such thing as free energy. It's one of the biggest rules in the universe. But you place energy within the system and then it is automatically released. A muscle has this potential. Then you have the contractile component. This is muscle fibers are being activated and they enable tension development. Basically, the cross bridges that you remember in your physiology course between our actin and myosin filaments create tension actively as well. Okay, so the elastic component is where strain energy and tension is developed simply by stretching the muscle, and then it can also develop tension and force by actively contracting towards its center as well, physiologically, through our cross bridges, through the cross bridge system of our sarcomeres. That brings us to something called the stretch shortening cycle. This is where we're adding the elastic component to the contractile component in so many words. This is where we see an eccentric contraction, which is the muscle is still creating tension, but it's being lengthened, followed immediately by a concentric contraction. Okay? So a tense muscle is stretched, and that provides elastic energy or strain energy into the muscle, and this causes an elastic recoil effect. You stretched out the rubber band and you let go, it collapses in on itself. This contributes to effective development of the concentric muscle force in many types of sports. If we're looking at somebody throwing a football or a baseball, they kind of rotate away and stretch out their shoulder flexors and horizontal adductors immediately before throwing the ball. They're stretching out those muscles and putting strain or elastic energy into those muscles. And then when they can concentrically contract those muscles, they're creating active force as well. That's the contractile component. So they're adding that strain energy to the contractile energy so they get a better throw, a more forceful throw. We can also see this if we're looking at sprinters. Is usually there's a starting block for sprinters, and having the starting block at 30 or 50-degree angle to the track rather than 70 degrees leads to an increased stretch of our Achilles tendon. And our Achilles tendon is very, very, very elastic. It likes to be stretched. And when they push off from the blocks, not only have they stretched that Achilles tendon, but they're adding the contractile component or contractile energy of the muscles to the elastic energy of the Achilles tendon, so they get a better, more forceful push off from the blocks, and it helps with their sprinting time. So let's talk about the structural organization of skeletal muscles. Okay, so how many muscles are in the body total? There are over 639 muscles, depending whether you've got the gene expressed for the palmaris longus. If you don't know what it is, look it up. It's actually really cool. It tells you a little bit about, you know, how friendly your great grandparents may have been with a Neanderthal. But roughly you have 639 muscles in your body. But how many of those muscles are responsible for body movement and posture? Only about 150. All the other ones are muscles that control your eye movement, swallowing, the smooth muscles of our digestive system, the muscles that help constrict or dilate capillaries, the one really big muscle, which is your heart. It's not considered, doesn't really consider to control body movement. So 150 are responsible for body movement and posture. When we talk of a muscle fiber is a single muscle cell that's kind of thread-like. That muscle fiber consists of our filaments, our myosin and actin filaments. This muscle fiber is encased in what we consider the fascicle, which is wrapped by a perimysium. So we have multiple muscle fibers wrapped and grouped together. We have multiple of those are surrounded by our perimysium and then are supplied with blood. They're wrapped by a blood vessel to supply them with blood, and they're wrapped by the epimyosin, and then they converge into a tendon and connect to the bone. So when these muscles contract towards their center, they're pulling on the tendon, which then pulls on the bone. Within the muscle itself, we have what's called a motor unit. A motor unit is part of the neuromuscular system. The motor unit is what delivers the signal from your central nervous system to the peripheral nervous system to a specific dendrite down the axis of a neuron, and then it interfaces with the muscle fiber at our neuromuscular junction and signals the muscle fibers to either contract or relax. What's interesting about this is a single motor unit may contain from less than 100 to nearly 2,000 muscle fibers. And when a motor unit is signals its group of fibers, whether it's a 100 to 2,000 fibers, doesn't matter the amount of fibers it's responsible for. When one contracts, they all contract. So a motor unit is responsible for every muscle fiber it's related to. Okay? A single motor neuron and all its fibers are innervated by it. Some motor units are larger than others. Some motor units have more fibers it's in control of. Some have less. Generally, smaller motor units are in muscle groups that require maybe a bit more dexterity or agility. So we can move, if you look at your hands, you can move multiple fingers at the same time. So we have more motor units in our arms and hands than we may have in our gluteal muscles. But the gluteal muscle motor units may be larger. So besides the motor units, when we look at fiber types, we have fast twitch muscle fibers and slow twitch muscle fibers. You'll also hear fast twitch muscle fibers as anaerobic muscle fibers, as far as they don't require oxygen to produce and use ATP. They might also be called white muscle fibers because they don't require oxygen, so they don't have as much circulation as the slow twitch muscle fibers. But the fast twitch muscle fibers are important for fast, powerful contractions. Okay, they reach a maximum tension more quickly than the slow twitch muscle fibers. And so they're used a lot during sprinting, jumping, anything that really requires quick, powerful contractions. The opposite of that is our slow twitch muscle fibers. These you'll often hear referred to as aerobic muscle fibers or red muscle fibers. They're red because they're perfused with blood more. They have more heat. They have more hemoglobin. The iron in hemoglobin makes them red. And they're important for endurance events such as marathon, cycling, and swimming. So there's another distinction between these, and this is more of a broad distinction. It doesn't quite work out perfectly like this, but it would be another hour of talking about physiology to talk about it in detail. But broadly, we see fast twitch muscle fibers tend to get fatigued quicker, and there's two types of them. If you've taken physiology, you learn that we have two main types of fast twitch fibers, but then there's virtually an infinite number of other subtypes of fast twitch fibers. But generally, we see that fast twitch fibers fatigue more, even though they can contract quicker and more powerful. Whereas slow twitch muscle fibers, because they use aerobic metabolism more, fatigue much more slower, and they can actually be almost indefinite because they're always receiving oxygen and energy from the blood. We also can look at identifying muscles by their architecture. There are two main types of fiber architecture. We have parallel fibers, as in the fibers are parallel to the long axis of the muscle. A good example of that would be your biceps, especially the brachialis muscle, or your rectus abdominis muscle, basically what you think when you have a six-pack, that's your rectus abdominis muscle. Then we have pennate muscle fibers. These are fibers that act at an angle to the long axis of a muscle. These are your gastrocnemius and soleus muscle that are in the back of your lower leg, your calf muscles. So our parallel muscle fibers we see is all these fibers are running in a straight line parallel to each other along the straight axis of the bone. These are good because they can contract much more quickly than our pennate muscle fibers. However, because these are angled into the muscle line of action, the long axis of the muscle, more sarcomeres can be packed in there per muscle fiber. So we're able to produce more force, but they contract much more slower. And then we can look at classifying pennate muscle fibers. Again, we could say there are unipennate muscles. Uni means one, pennate, the angle of pennation, so there's one angle of pennation. Then we have bipennate muscle fibers, like your gastrocnemius muscle, where it has two angles, so one and two angles of pennation. Then we have muscles beyond that, we call them multipennate, where they have more than two angles of pennation. That's muscles like your gluteal muscles, your gluteus maximus muscles, have multiple angles of pennation. And they can generate very large amounts of force, but at a slower rate. But this is preferable if we're looking at maintaining an upright posture and keeping your legs extended for long periods of time. These muscles do a very good job with that. So which muscle type is better, pennate or parallel? They're both the best. Pennate muscles have more fibers per unit volume, so they can generate more force than the parallel muscle fibers of the same side. However, as pennation angle increases, the smaller the amount of effective force is transmitted to the bone, and it takes them longer. Parallel muscles have a greater range of motion, and they contract a little bit more quicker. They're more dexterous or more agile, if you'd like. So which muscle type is better, pennate or parallel? Continue. We have redundant muscles. The soleus and the gastrocnemius are both ankle plantar flexors. However, the soleus muscle only does plantar flexion. The gastrocnemius does plantar flexion and knee flexion. So dependent on the requirements, such as range of motion, explosive force, endurance, each muscle will have different properties. And that's where we kind of look into, well, really the structure of the muscle and joint dictates its function. So skeletal muscle function. When a muscle is contracted, the force developed by the muscle pulls on the attached bones and creates a moment at the joints crossed by that muscle. So when we look at this, destroying my pen here, when we look at this, we see that this muscle right here we're going to say it's concentrically contraction. So it's shortening towards its center. Sorry for my sloppy writing. Okay. And it's going to pull upwards on our forearm bone, either radius or ulna right here. Okay. It's going to pull upwards and cause the motion of arm flexion. So what you may have already kind of noticed, and we haven't gotten into it yet, but we did kind of go over that with the math review assignment, and even the math review lecture, is what we've essentially done here is to create a triangle. Okay, so I'm going to get rid of this just to clean up everything just a bit. Just to clean up, give ourselves a little bit more room to work with. Okay, so what I'm looking at essentially is a triangle. Oops. All right, my pen is acting up. So this would be our humerus, the first one here. I'll just put it HU for humerus. And then we have our arm, and we have our arm right here, our forearm. Then we have our muscle connecting our humerus to our forearm. I've created a right triangle. So then, by knowing the length of these two, I can figure out the length of this muscle. If I knew the force this muscle is contracting with and the angle it inserts in, then I could figure out the other forces. I can figure out the translational force. I'm just going to say F of X right now. X. And the rotational force, F of Y. Sorry, my pen is kind of crapping out on me here. But that would be my F of Y force. that F of y force is what we consider to be the rotational force. Okay? We won't get into that too much right now, but it may be important later. So, skeletal muscle function. Why do we have multiple muscles to complete the same function? Because there's multiple roles a muscle can be. We have an agonist, an antagonist, stabilizers, and neutralizers. An agonist is a muscle which contracts and causes the desired movement. So during elbow flexion, the biceps muscle is the agonist. The opposite, the exact opposite of an agonist is an antagonist, which opposes the desired movement. Either it's doing eccentric contractions or it's relaxed. So during elbow flexion, the tricep muscle is the antagonist. Generally in motion, what we see is when we're looking at the desired motion is the agonist concentrically contracts while the antagonist relaxes. We also have a role of muscles called a stabilizer. A stabilizer muscle mobilizes a body part while another body part is moving. So if we're looking at this figure here, the weight of a flexed arm tends to put the shoulder into hyperextension. This would make a arm flexion more inefficient, okay? And it could lead to a greater risk of injury. Therefore, the shoulder flexors must stabilize against this force for proper lifting form. So our shoulder flexors are contracting isometrically. They're not changing their length, they're just stabilizing the shoulder so that the forearm flexors have a more efficient, stable platform to pull from so that just the forearm is moving. Then we have neutralizers. A neutralizer is a muscle which acts to prevent unwanted accessory actions by the agonist. For instance, the bicep brachii, the two-headed muscle in your upper arm, okay? That not only causes elbow flexion, but it can also cause the supination of the hand through the forearm. Therefore, we need muscles that produce pronation to cancel out the supination of the bicep brachii. If we had a muscle, let's say the rectus femoris of your thigh, okay, it's one of your quadricep muscles. Okay, you have the rectus femoris, vastus lateralis, vastus medialis, and vastus lateralis, vastus medialis, vastus lateralis, vastus intermedius, excuse me. The rectus femoris causes knee extension and hip flexion. So we need a neutralizer to produce hip extension so that when we activate the rectus femoris for knee extension, we just see that knee extension. So the take-home message for this part of the lecture: human movement requires the cooperative action of many, many different types of muscles. So let's talk about two-joint and multi-joint muscles. Many muscles cross two or more joints. We see this in the posterior of the lower leg with our gastrocnemius muscle. It crosses the posterior ankle joint at the Achilles tendon and the posterior knee joint. So it can cause plantar flexion and knee flexion. We see the same thing with the posterior of the thigh with our hamstrings, where they cross the knee and the hip. So we see knee flexion and hip extension. Same thing with the front of our thighs, our quadriceps, specifically our rectus femoris muscle, is these cross the anterior of the knee, causing knee extension, and the anterior of the hips, causing thigh extension or hip extension. So there are some other examples of two joint muscles as well. The biceps, bicep brachii. We see elbow flexion, shoulder flexion, horizontal adduction, adduction of the shoulder, and forearm supination. For our triceps, especially the long head of the tricep, brachialis, we see elbow extension, and shoulder adduction. We talked about our hamstrings with knee flexion and hip extension. We talked about our gastrocnemius. We talked about the rectus femoris and our finger muscles. Oops, I went back a little bit too far there. But our finger muscles, I'll just kind of take it from here. When we say our finger muscles, we have kind of two groups of hand finger muscles. We have our extrinsic hand muscles or extrinsic finger muscles, intrinsic, excuse me. These are muscles that start and end in the hand, okay? These muscles are much smaller muscles. They're not super strong muscles. Then we have the extrinsic wrist, hand, finger muscles. These are muscles like the extensor digitorum longus, flexor digitorum longus, which start in the forearm, go through the carpal tunnel and associated structures in the wrist, and then connect to our distal phalanges, or distal fingers, okay? These are our two joint muscles. These bring a good example of, we're going to start talking about active and passive insufficiency. But the muscles that affect motion across all joints crossed, these are our multi-joint muscles. They're helpful during power-based activities such as jumping and sprinting. Also in the hands, they reduce the muscle bulk in our fingers. Once again, as we do have muscles in our hands and fingers, but they're smaller. And if we had really big muscles in our hands and fingers, we couldn't use our hands and fingers, and the muscles would get in the way. So there are some disadvantages of our multi-joint muscles. The first one is active insufficiency, or the inability to develop tension, where we cannot contract these muscles to produce full range of motion. The other one is passive insufficiency, because we cannot stretch for the full range of motion due to tightness of a stretched multi-joint muscle on the opposite side. For active insufficiency, try this. Make a very, very tight fist with one of your hands. Right, relax your hands and then do wrist flexion and wrist extension. Notice the amount of range of motion you have. Now tighten your fist as much as you can and try to do that same flexion and extension. You'll notice that you're able to do much, much less. That's simply because, especially the extrinsic finger flexors and extensors and wrist flexors and extensors have already been shortened so much that they would actually have to shorten even more to allow you to get full range of motion at your wrist. With our passive insufficiency, think of it like this. If you had very tight hamstrings and you tried to bend at your waist and touch your toes, your hamstrings are only going to allow so much motion because they may be too tight to allow your hips to flex on the other side of your pelvis and hips. So factors affecting muscular force generation, excuse me. We know that fiber type, all these factors affect how much force can be produced by muscles. So you know that fiber type has an effect. The muscle size, obviously, the bigger the muscle, the stronger it is. The number of fibers, the more fibers, the stronger a muscle can be. And the pennation angle. Remember, the more pennation angles there are, the more force can be generated, but at a slower rate than our parallel muscle fibers. This can affect force generation, but within the same muscle on the same day, will you always get the same force when the same electrical signal is sent to the muscle? No. The same muscle will not develop the same force from the same electrical signal. This force is dependent upon three factors. The force-length relationship, which I will say right now is, I will do my best to not misname it, but I sometimes call it the length-tension relationship, but I will do my best not to say that. The force-velocity relationship, and the electromechanical delay. So the force-length relationship. First, recall the two major components of a muscle. The elastic and contractile components. The elastic component is when we stretch the muscle, we're placing elastic energy within the muscle. The contractile component says that when a muscle contracts towards its center, it's also producing tensile force. Okay? The force-length relationship is different from these contractile and elastic elements. Second, what is a force-length relationship anyway? So let's take a look. So an example of a force-length relationship. Consider taking a piece of elastic, a rubber band, and stretching it at a set distance. Then you record the force within the elastic at that distance. Next, take the same rubber band or elastic and stretch it again. Stretch it a little bit further and measure the force at that new distance. The length change will be plotted across our x-axis and the force plotted against our y-axis. So here we start, okay? So we took a piece of rubber band and we stretched it to 1 centimeter and recorded a force of 1 Newton. If we then stretched it to 2 centimeters, we'd record a force of 2 newtons. So we're seeing a nice linear relationship with a rubber band. The same thing can be done and has been done with muscle. I don't think we do it much anymore, but way back when we were still trying to figure all this stuff out, we'd get muscle samples and stretch them and figure out what they do, and I'm sure plenty of them tore. But the same thing can be done with muscle to determine the contribution of the elastic component to the force. Notice how we indicate the length of a muscle. We're not measuring in centimeters, millimeters, or anything like that. We're looking at the muscle length as a percentage of the resting length. Note that this is the elastic component only as well. We're just looking at the elastic component really quick here. If we begin to stretch the muscle past just under its resting length, we see more tension develop within the muscle. We're not looking at the muscle's contractile ability here, or tension creating ability. We're looking at just the elastic energy within the muscle as we stretch it. The further we stretch it, the more elastic energy or more elastic force we see. What will the force do to the contractile component? So the optimal force will be developed at the resting length because the maximum number of cross bridges can be formed. Those are the cross bridges between our actin and myosin filaments, which you should have seen in physiology. And the lowest force will be developed when the muscle is either too short or too long because there are reduced cross bridges available with each of these lengths. So what will the force do to the contractile component look like? We're just looking at the contractile component and still at muscle length as a percentage of the resting length. We'd see kind of a nice hyperbolic thing where roughly at 100% of its resting length, maybe just a bit beyond it, maybe 110, 115% of its resting length, we see its maximal amount of force it can produce. But anything short of that or larger than that, we start to see a decrease in the amount of force produced. So let's combine these. because we can combine elastic energy, or force by the elastic component, and force by the contractile component as well. So if we add these, we'll look at the contractile component, then the elastic component, and we'll simply extrapolate beyond there. We see that the contractile element peaks at 100% of the resting length, and the elastic element peaks at 150% of resting length of the muscle. We are adding the contractile and elastic component, and the muscle has peaks at both 100% and greater than 150%. So we see that if we either contract the muscle or lengthen the muscle, we're adding force into the muscle. Which brings us to another relationship, the force-velocity relationship. Let's take a look at this graph, and we'll answer some questions here. If we're looking at, on the x-axis here, we have a negative VE and a positive VE. The VE stands for velocity. So either we have zero velocity, a negative velocity, or a positive velocity. On our y-axis, we have force. The higher the y-axis goes, the more force we have. So let's answer the first question here. What type of contraction has a velocity of 0 meters per second? Well, 0 meters per second is zero velocity. Velocity, once again, is a vector, which means it has a magnitude and a direction. So we have three types of contractions. We have a concentric contraction, in which the muscle shortens towards its center. We have an eccentric contraction, in which the muscle is forcefully lengthened. And then we have an isometric contraction, in which the muscle does not change its length at all. So we're saying it doesn't change its length. If it doesn't change its length, it has zero change in direction. So if it has zero change in direction, it has zero velocity. So we'd say that this middle caption here is going to be our isometric contraction. Okay, so according to our force-velocity relationship, we have limited force in our isometric contractions. Let's move on to the next one. Which one has a positive velocity? We'll take some creative liberties here, and we'll say that the distance is positive, or the displacement, is positive if the muscle is shortening towards its center. So if a muscle is shortening towards its center, it's a concentric contraction and has a positive velocity. So we'll enter in concentric right here. My pen is getting old and worn out. That's our concentric contraction. Then finally, because we don't have any more options left, but we'll consider a lengthening to be negative displacement. So we have a negative velocity with our eccentric contraction. So what we can see here, though, is that we develop more force with eccentric contractions than isometric and concentric contractions. So we have more force with eccentric contractions and less force, more force with eccentric contractions and less force with velocity contractions, with concentric contractions, excuse me. I'll say it again, is we can develop more force with eccentric contractions and less force with concentric contractions. More force with eccentric contractions, less force with concentric contractions. So the force-velocity curve was developed by determining the maximum tension and force at each velocity. When the muscle shortens under a load, our concentric contraction, that tension decreases. When the muscle is lengthened under a load, our eccentric contraction, the tension increases. Okay? So that's our force-velocity relationship. However, this does not mean that it is impossible to move a heavy load at a fast speed or move a light load at a slow speed. It's a common misnomer with this relationship. So quickly, let's talk a little bit about strength training and how to use eccentric and concentric contractions as far as gaining strength. Because of our force-velocity relationship, we see eccentric contractions are more effective at developing muscle size and strength than concentric contractions or isometric contractions. But there is a risk of greater structural damage and soreness with our eccentric contractions. So there's a trade-off. So let's talk about our last two slides here, the electromechanical delay. This is the time period, roughly 20 to 100 milliseconds, which is the time period when a muscle is stimulated and when tension is developed in the muscle. This is around, once again, 20 to 100 milliseconds. So the nervous system, or actually the muscles, it requires about this time for this impulse to travel through all the nerves and then initiate the actual muscle itself. Then the actin and myosin filaments have to get to work. Okay, so it takes a little tiny bit of time. A good example of this, of the electromechanical delay, if you guys have looked or studied this at all, but when you're looking at an ECG and you're looking at the PQRS complex of the ECG, you see something like this. There is this delay here. Okay, this delay here is the PR interval, and this is simply the delay it takes for the signal that signals the heart to beat to go from the atria to the ventricles of the heart. This is the same electromechanical delay. So, and for your exam, I don't think you need to go too much into the electromechanical delay. You should just know that it is a factor, but it's not too important. So this is the end of the lecture for muscle properties. I went a little bit over, but it's not like you got to get out of class. So I hope this was helpful. If you are stuck on any of these concepts, please feel free to get a hold of me. Goodbye.